Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy, the weekly podcast brought to you by the Takshashila Institution, where we talk about the ideas and policies shaping India's future. I'm your host, Swathi Kalyani, research analyst in the Geospatial Programme. Recent reports have indicated an uptick in COVID-19 cases across several regions of India, serving as a stark reminder that our battle with infectious diseases is far from over. The pandemic years fundamentally transformed how nations approach disease surveillance and public health response, with countries worldwide discovering the immense potential of digital technologies in tracking outbreaks, predicting spread patterns, and much more. From real-time contact tracing apps to AI-powered modeling, we witnessed an unprecedented acceleration in health tech adoption that saved probably countless lives. But many questions remains. How do we build on these lessons to create more resilient public health systems, and not just for crisis response, but for everyday healthcare delivery and preventive care? Today, I'm joined by Akhil Siddharth, who works at the eGov Foundation, focusing on building health campaigns management platforms to help governments currently in Africa and to explore how technology can truly catalyze public health service delivery. Hi, Akhil.
Hey, Swathi. Thanks for calling me.
So we'll look into where, how our country currently stands in this digital health transformation, if it can be a soft power tool, and even examine the gaps that still need bridging. So let's get into it. And can you walk us through what ground level health data collection looks like in practice? What are you actually measuring and mapping in these African communities that you have worked currently?
Sure, Swati. Brief of health campaigns management tool that eGov Foundation has built specifically for Africa. Where routine immunization fails, we do health campaigns, and they've been running for a while. So something that eGov has taken a stance is how can we better ground level health data collection, and how can I make it richer? So what actually happens is before it was digitized, you capture who you're giving your particular vaccine or your intervention to. This is to reconciliate, to keep stock of inventory, or also to even know how much of the vaccine got spent. So we would collect house level data, right? For example, the number of children under 5, because that determines the vaccine that is given, and the name of the household, or where the house is. So all these basic information, so that you can sort of reuse this information, is what is actually collected on the ground. And we also map health facilities, schools, and local boundaries, because basis which those health campaigns are run.
Okay. And coming into probably the geospatial part a little bit, how has geospatial technology or GIS platforms transformed the way that these public health interventions are planned and even delivered compared to, the traditional methods that you mentioned? And can you probably share a specific example also where having such, precise health data, geospatial health data actually made a tangible difference in the outcomes that you aim to have? And how does these technologies actually complement each other for bettering whatever health initiatives are there?
Sure. So definitely geospatial technology has been really transformative in the space, from pen and paper before, where people would not know, or post the campaign, they would know, hey, we missed out a particular house or a settlement. It has helped them identify in real time if you could actually miss the household or not, or why it was particularly missed, or why couldn't we plan better. So there's a lot of planning that happens before these campaigns are done, and geospatial technology has been the most transformative there. For example, which health facility you should be looking at this particular village. Geospatial really helps that, maybe in terms of terrain or even connectivity. That way, the WHO has been in the forefront of doing this, and we've collaborated with the GIS Center in WHO. A specific example There are two examples, actually. One which helped the world. For example, during the COVID outbreak, it was due to creation of heat maps that we could actually cordon off certain areas and enforce lockdowns.
Can you just, define, like, simplify those heat maps? Like, we hear it a lot and, everybody talks about it. Like, just explain that also.
Sure. I just threw a
Yes.
term there, but heat map is. Let me just take an example, right? So
Yeah.
you have a map, and there is a particular occurrence of a certain activity, and then you can see based on the color gradient and all, what's the occurrence of that activity. For example, let me just say you want to know where's traffic in Bangalore, and then you want to see the hotspots in Bangalore. Let's say you have a map of Bangalore, and then you have, let's say, number of cars in a road. What if I could make it more red? Something that Google Maps does, right? That is a form of a heat map. There are multiple
Okay.
forms in which, so yeah, that's a visual way of representing a particular clustering or density of a particular instance there. So that was in COVID, but something that I saw up close in my work in Africa was a particular campaign in Mozambique, where they were actually delivering interventions for malaria. This is to prevent malaria for children below the age of 5. Particular villages were missed, and the health administrator in the health ministry could actually identify very quickly in real time, asking for why that particular village was missed, because we don't want to leave any child uh, unvaccinated, right? So geospatial there was a game changer, because that person could only identify that because there was ground truthing, and then you could actually see, hey, there's no marker here, there's no heat map there. So that's when we realized it was a game changer, and we could quickly deploy resources and get that health intervention in that particular village. But these are some real life examples of how geospatial really helped.
Interesting. So when you're building these information repositories, since it involves a lot of ground level data, and then you need to have geospatial information, then you need GIS platforms to integrate all of these. There are surely some obstacles that you would have faced. So what are the biggest challenges that you have faced in ensuring this data accuracy and probably completeness in this remote or underserved areas?
So one thing that we noticed was, to get ground level data, you need people going on the ground mapping these things. So that's been a problem. Apart from that, access to satellite imagery is expensive, and also the tools used to map, right? For example, ArcGIS Pro. You need to be trained in this, and usually in sub-Saharan Africa or Western Africa, where in general things are developing now, they do not have access to GIS experts, not as many as they would like to. So it's basically more training and capacity building that we saw for these tools to be utilized, and also the importance given to them by the government, because they have other fires to quell, is something that we're seeing. But this is changing quite a bit in recent years.
And in comparison to India, like how does the database look like for both the regions? Like, how, if you're comparing these nations in Africa to the healthcare systems in India currently, how does that look like?
So India is better off. We're, of course, one of the larger economies, and we also have an ISRO where we can get our own satellite images, which the African countries need to rely on other countries for. The only thing maybe is, and which is changing in the government, is access to this data from the Indian government. And also there is GIS capacity in India. That's one thing. It's much better than Africa. There are more GIS specialists in our country, but I think there is still enough scope. I know you're a GIS expert. You should tell me. There's always a deficit of GIS folks, but we're definitely better off. It's just access to the data, I think, is a more problem in India than getting the data.
Yeah, and I think that's also like there's also a correlation, because many of these African nations have actually the growth of population rate is quite high. Like, it's not the other Western countries or developed countries also, where it's the population rate and growth have all slowed down. But I think in Africa it's still high, right? So this healthcare services actually become more crucial in such communities and regions.
Absolutely, they have more vulnerable population, and it's it's
Yeah.
always ironic that people who require the help are actually even more far off from receiving that help.
Right. Yeah. Also, so what are there like any few African countries which have actually improved, their public healthcare systems, and when it comes to the surveillance and monitoring everything?
So, from the countries that we worked with, we've seen it is a factor of per capita income, as simple as that, on
Okay.
how training was done. But starting from there, for example, Nigeria is pretty ahead in terms
Oh.
of access to maps or getting access to GIS experts. They're pretty good, and they understand it, right? Even the government also understands it. They're ready to invest in it. Or if someone's actually talking to them, they're more than happy to engage with multiple private partners too. That's something that we saw in Africa, in Western Africa, especially Nigeria. There is a WHO Afro Center, which only looks at the African uh, countries for
Okay.
helping them in GIS only. So there is a specific GIS center running out of this is in Congo Brazzaville.
Okay.
So they're actually helping all the countries build capacity and do better.
Do you have also an idea about like how private players are contributing to this? When it, of course, these satellite images and even the GIS platforms are mostly these private players do have a major role when it comes to this sector. So, have they contributed, or do they also link up, with your foundation itself, and even with the countries directly in helping through these initiatives?
So yes, something that we saw in Africa was that in the previous GIS summit that happened late last year or early this year, actually, was that the SRE, being a large player in this market, had come to the conference and actually offered a few free licenses to each country
Oh,
so that they have access to this tech. So and then they get a taste of it and they know what to invest in. So that's already there. And also there are a few African countries, and I wanted to add this, especially for geospatial, right? You want to verify it too, right? It's not
yeah.
100% accurate in terms of maybe there's a difference in the clarity or something like that. There are teams out there in Africa. I'm aware of a particular organization called DevAfrique who does ground
Okay.
truthing. They go and verify if it is true or not. So you know the information is 100% right and you can reuse it. So yeah, that way they're developing quite a bit.
Nice. And so let's come to India. And India does have certain IT expertise and even geospatial expertise. And how is India actually leveraging it and probably scaling it to become a leader or become, a serious player when it comes to this geospatial health technology and probably what we call now as the global south countries? So where do you think India is currently standing?
So for one, I think India is extremely well suited to solve for the problem because compared to a country in the West, which is sparsely populated, or they have access to better technologies, India is more in the league where it's pretty dense, and some of the geographies in India are very similar to in Africa or the global South. So that way we can leverage technology, and also, I think, yeah, we definitely have. And much more number of experts in our country already leveraging. I believe in the government has opened up the geospatial space. There are so many centers of learning. I think we can actually build capacity for these nations where they can come, we can train them in these tools. So that's one particular thing. And also, we can also export these tools, right? If something really worked in India, that's for example, this is not really geospatial, but for example, Covin worked in India, and my org was involved in having a similar software in other countries. So we clearly
Okay.
have a runway ahead, and I think we are well suited to help our global South companions.
Yeah, I mean, I think Coven was a remarkable success, and I think we have also made it like the UVIN portal now, which is
Great.
like it is actually like expanding our immunization and so many other factors when it comes to the health sector itself. Also, from a soft power perspective, what opportunities do you see for India? Not just like, let's not just look at African nations itself. There are like a lot of developing countries that are looking around. And when it comes to actually space sector, now we see, how ISRO is helping other countries to launch more satellites and all that. So it could also move towards these information dissemination itself. So where are the opportunities, not just in this geospatial sector itself, but like we also have a good workforce, right? So maybe there could be like more interlinked programs there.
Yep. So definitely in India, this is part of the G20 declaration that we promote a specific style of infrastructure called DPI, digital public infrastructure.
Yes.
And this really helps the global south because we are one of the most important thing in this entire game is data, right? Geospatial or any health data. And now data sovereignty is a big thing. You want to own your data. So these countries, any of our neighbors or global south trusts us because we are telling them that we'll help you, give you the know-how and also let you store the data in your own country so you can control it. So I think that way in terms of direction and also what the prime minister set in terms of our software, I think we're doing great. In terms of health also, and COVID being an example, right? It was open sourced as DIWalk and spread across, UPI is spreading or Aadhaar is spreading. And also, for example, the Ayushman Bharat digital mission that I worked previously, many countries would come with their delegations to know how India is implementing such a digital health mission so that they could get inspired and, take in these frameworks and do it. So that way, I think we are suited. We're doing good stuff. We can do more. So yeah, we're in the right track.
Yeah, let's focus on we can do more. So what can we do more? Like, I'm sure like there'll be ripple effects of these things, right? I mean, when you create something which is useful for others, it also creates opportunities within your country. So yes, what can we do more there?
Oh, definitely. So, for example, right, I think there needs to be a push between the public and private sector. For example, the framework and design can be from the government, but the actual implementers are private folks who can actually build it very quickly and at scale. So, for example, let's say a particular mission that was, done by the government, but you had a private player, let's say one of our big players like a TCS or Infosys support it. It's very, very easy for them to do it in another country too. So then we start with the policy and then we even give them the options of, we can build it for you very quickly. So it's a win-win for everyone here, right? So the other country got the tech, India got to do its soft part push and also jobs in our country to be able to implement similar systems. So I think that's a good way to go about it.
Right. This is where the technical expertise is going to come in. Also, what would be the emerging technologies that, I think you are very excited about probably, this discussion about AI and real-time sensors, all this is like the buzzing words. So what are you probably excited about in this field?
So one thing I was really surprised today, and we're actually working on it, this is not in the future, is finding population estimates. Right. Some of these countries, many of the global south, it takes a lot of money to do census. And our country's own census has been pending for a while. So you can just imagine for poorer nations in Asia or Africa to do that. But using geospatial technology and AI, you can actually find the population estimate. And there is a margin of error, but it's pretty accurate to predict demand or, order vaccines there. So I can actually dwell a little bit more on, and it's WHO's work. So shall I go deeper into this?
Yes. Please explain. I also know this like even when our census was delayed, right? There was these population reports which come from World Bank, right? Or UNDP. So yes, please explain that. Yeah.
So how it actually works is first we need high quality geospatial imagery of an entire region. And post that, there are several models, machine learning models to actually train. So the most exciting thing about population estimation is that using AI, you can actually estimate the population. So how it actually works is first you'll have to get a lot of geospatial information or images right there. And then you need to start training the data set. saying that you identify a household, you identify the type of household, and then you come up with an estimate of what the population or number of people in that house can be. And then once you have a particular data set like that, you can start feeding it new images and it will start giving you population numbers for that particular area. So it's being used right now, wherein, let's say I have a 50 square kilometer radius and I don't know what the population is. And it's very hard to send people down there, right? So then if I want to know these numbers before, since I've already have a pre-trained data set, I can feed these new images and get those population estimates, and I can place my vaccine orders better. So something like how you mentioned the World Bank report, I believe they're doing different methodologies, but this is being done for healthcare actually.
So, Akhil, I think you've given a lot of insights about what's there, what's missing, and what will probably be there in a few years. What would you tell policymakers about, why investing in specifically geospatial health infrastructure should be a national priority, should be a global priority? I mean, with all the experiences that we have had post 2020.
I'm actually picking this line from someone I heard from the geospatial space that I respect, is if you can't see it, you can't serve it. So you want to serve your population, you need to see it. So that was a great line that stuck with me. So geospatial is required for you to have a resilient and responsive healthcare system, to enable better resource allocation, to prevent crises, right? For example, the COVID example that you just spoke about, it's very critical for disease surveillance. You know where these cases are, so you can actually cordon off areas and, you can see the pattern emerging. So clearly, I think the pandemic was a big calling for us to actually see that someone who had better maps and better geospatial tech could actually intervene better and save lives. Because I think everything that you do in the end, I'm talking from a public health perspective, this is literally between you being alive or not in large numbers. So I think it's really as important as it gets. And the ROI is very good. I think the amount of money that you spent on geospatial and the returns that you get is really, really good. I think taxpayer money should be spent more on such tech.
Correct. It's probably not like those physical infrastructure that would be visible, but it would have so much of intangible benefits across, not just like health infrastructure. You should just, get into all other sectors and use it. I would just, vouch for anything which includes much advanced geospatial tools and platforms and everything. So thank you, Akhil. That was an insightful conversation. Gave me a lot of knowledge about something in Africa that I was not much aware of. And I hope our listeners also got to know about it a lot. So thank you so much.
Thank you, Swathi.
If you liked our show, dive into Takshashila's research on technology, strategy, and economic affairs. Check us out at our Twitter handle @Takshashila INST or our website takshashila.org.in.